So recently I had a runner in a Facebook private group ask me if it is possible to return to running with a meniscal tear. The answer is yes, but there's a few steps that we want to take. But better yet, I'm going to give you my ultimate knee protocol hack, which is going to help you get back to running and help you overcome that meniscal injury.
It's about getting to the root problem.
Hey everyone, it's Dr. Heather here, your virtual sports chiropractor. And as you all know, I created this channel for you, my running community especially, to help you guys get back to running safely and effectively by doing certain types of corrective exercise and rehabilitation techniques that you could do right from the comfort of your own home. Today, I want to really talk to you about meniscal tears. There's a ton of videos right here on YouTube that really go further and further into depth regarding meniscal injuries. But the best thing I'm going to do for you guys today is I'm going to actually give you a secret hack that has worked for, I would say, almost over 100 of my runners, especially those who have been suffering with either knee bursitis or a medial meniscus damage. So first, I want to kind of talk to you guys about a meniscus tear. Now, yes, if you are going to start running with that meniscal tear, I'm not going to lie, it's going to be painful. Chances are you're going to experience a lot of pain and discomfort initially when you start running with that meniscal tear. It is not advisable to go ahead and continue running while you have that meniscal tear. What we want to do is we want to kind of stop running for a moment, maybe a couple of weeks, address the issue, address the problem, correct it, and then get you back out onto that road surface safely. For those of you that don't know, meniscus tears can be caused from a traumatic event like a sudden twist or turn of the knee, or from wear and tear like that of arthritis. The type of meniscus tear you have affects the activities you will be able to do while recovering. Now, the good news here is, for the most part, running is a straightaway action. It is not a side to side. It is not a pivot type of motion where the tibia head and the femur will then go ahead and create that pivoting rotational pattern that you see right here on the screen. Running is, again, one of those things that can always put more stress on the knees depending on what's happening at the foot and ankle and what also is happening at the pelvis, the hips, and actually the low back. So the knee is where all the force, all the load, a lot of the times winds up, and then we notice that we get these kind of, aches and pains around the knees, stiffness, swelling, you name it. So what I want to do for you guys is really give you my hack in terms of how to kind of go ahead and really successfully kind of get back onto the streets, the pavement, the trails, whatever it is you're doing for running. And we're going to break that down right now for you. Okay, here are the bullet points that you need to pay attention to. One is you can definitely use a TENS unit. If you're not familiar with a TENS unit, it is a low voltage type of physical therapy modality. You can buy them right off Amazon. And actually, I've gone ahead and always recommended that my patients that I work with who do have either meniscal damage, ACL damage, or even knee bursitis, go ahead and grab one, because we can use it to really help decrease the swelling, but also to increase muscle firing patterns around the knee as a way to strengthen the actual knee joint. So if you haven't got a TENS unit, I want you to go ahead, click that link I've left you down below and grab one. I'm also going to leave you the diagram of exactly where to place the pads specific for meniscal injuries, because that's going to be very important as well. So firstly, we want to start with an ice cup massage. And I've done videos before on how to make that ice cup. It's very simple to do. And if you haven't, do go check it out. Very simple. I show you guys actually using a shortcut from Starbucks because that's all I had access to. But if you have some Dixie cups at home, fill them with water, freeze them, create that ice cup. And what we're going to first do is really numb down that knee. So we're going to go ahead, we're going to put the ice cup kind of right over the inside and outside of the knee, over the top and under the bottom. And we're going to really get it nice and numbed. And if you don't know the stages of ice, we want to go ahead and feel that achy, burning sensation all the way until you feel numbness. That's how we know we really have done the job of icing down the knee. From there, we're gonna go ahead and take some BioFreeze. I'm particular to BioFreeze just simply because it's what I had access to in undergrad, but you could use Icy Hot, you could use Tiger Balm. They all have similar properties, but for all intents and purposes, I do like BioFreeze the best. We're gonna take the BioFreeze and we're gonna do some nice cross friction massage over the knee joint, and that will be mostly on the inside because, again, majority of us usually suffer with some type of medial meniscus damage, not really lateral, but you could always do it to the outside of the knee too. But you're gonna go ahead and do some nice cross friction massage, quick and short strokes using your thumb, and really kind of get in there, add some pressure to the area. Thanks to the ice, you shouldn't really feel any discomfort while doing this. From there, what we're gonna do is we're gonna lay on our stomach and we're gonna go ahead and place the foam roller just above our knees. And we're gonna start to go ahead and we're gonna foam roll out the quads in this position here. The other thing you could do is place the foam roller just above the kneecap and go ahead and just simply bring the heel towards the butt and then extend the leg back out. You'll feel some nice pressure there. It's almost like you're kind of breaking down the tissue, adding in a little bit more of what we call like an active release technique at this area too. So from there, we're gonna work on making sure that we foam roll out the quad. The next is actually, after you've done all these things, is now we're gonna place that TENS unit where I've indicated with those red pads on the knee. You do wanna feel the muscles starting to contract. Initially, you might feel some more kind of just numbness, tingling, like pain relief, not so much muscle contraction. But as we push the swelling out of the area and decrease that neurological kind of feeling that you have going on inside the knee, you're gonna go ahead and you're gonna see like the vastus medialis muscles start to contract and possibly the quad muscle too contracting around the knee, really allowing for some strengthening to happen without you really having to exercise. This is something that Bruce Lee was very fond of when he was recovering from, being paralyzed, really using a TENS unit to help with increasing muscle stimulation in order to really get back to fighting performance as well. So that's how we're gonna use the TENS unit here. And then from there, what we're gonna do is we're gonna go ahead and we're gonna ice it down again with our ice cup massage. Now, like I said, this is my specific hack. If you have specific questions, I want you to go ahead and drop those comments down below. And if you're curious to know if this will really work for your meniscus tear, book that free consultation with me. I'm happy to provide you some insight. I'm happy to review your MRIs and other studies to really kind of see if this would really work best for you or if there's another route you should be going. As always, thanks so much for watching. Don't forget to hit the like button if you've liked this video, and don't forget to subscribe to the channel. Make sure to get those notifications when we upload more videos wrapped around how to fix your pain naturally. All right, I'll catch you in the next video.